All right. Hello, everybody. Again, good morning, good evening, top of the evening, wherever you are. We are starting the live again. We had a little bit of technical glitch, which is great because that's what you're gonna have every step of the way in your life. So now, Dr. Halida, I'm just going to introduce her in the essence of time. We are here with Raj Kapoor, Kamrul Hassan, Ron Cooper, and Yan Roberts, and RT Moore. So we're going to get just a few minutes of discussion. I guess that's all we can do. There was a great and plethora of information that I know Dr. Halida has put together. She is like one of the, but she has a huge, 30, 35 years of career and experience and all those for young professionals and whoever is coming to this platform. Unfortunately, we were not able to bring it live, but we will probably bring it at a later time. But for the sake of time, as a grand opening of this session and the YTP platform, I would ask Dr. Halida to get started and squeeze in a few minutes of our talk, and then we'll bring her at other time, and we can all participate. Or if there's any question, anything that we can, or Dr. Halida can answer, please go ahead. Dr. Halida, it's all yours. Sorry about the little glitch we had, but we are excited to have you here. Thank you so much for being here with us.
Thank you very much, Sheikh Jillur Rahman, I know that you did a good introduction earlier, but this is definitely a great privilege to be on your platform and to start the program. And I know that you want me to talk on the opening session, and this is definitely a great privilege and great opportunity for me to be in front of the young professionals and young people. This is I just want to say that I'm a reproductive health epidemiologist, and I have run research institute in Bangladesh, and I'll be talking about my journey a little bit later, so I'm not going to talk much on that, but this is a great opportunity for me to share with you my experience. I know that this session is mostly dedicated to the young people, young titans, and I would rename the titans. I would say it's a beautiful looking monsters. The reason I say monsters, these are the millennial team, millennial group of people I know that you are planning to address. And the reason I say monsters, because you are ready to grab everything that come across in front of you. Um, you are ready to focus on how you prepare yourself for your career journey. You plan, you proceed, and you will proclaim. You definitely pronounce your space, your position, and you will do that. So, as you can see, also that this is a platform for you next leadership. And when I hear leadership, leadership is a very favorite word to me. For myself, for anybody, for everybody that I'm linked with, I would like to see them in the leadership position, be the leader from their heart, from their mind, from their position, and from their situation. So this is a very favorite word for me. As I know that I'm talking to the youth, I also always feel myself as young as I'm talking to the people. I never feel that, you know, I'm not young. So I have that enthusiasm. I talk to the people, I encourage people. Let me just share that um, when as I mentioned, that I'm currently a faculty at the School of Public Health, Bloomberg School of Public Health at Johns Hopkins in the International Health Department. I'm a faculty there. I joined 2 years ago. And when I live in the Homewood campus, and when I take my shuttle from Homewood campus to the medical campus, I see about 50, on an average, 50 riders with me. And I see them that they are always, let me just share before that when I was doing my doctorate at Hopkins, long time ago, we did not have a laptop. We had a big mainframe through which we did that, and we had to do all hand typing and everything. But you are so lucky. You are so lucky today that you have everything in your, in your laptop or in your Android, and the whole world is open to you. The whole world of knowledge is in your hand. The whole book of knowledge that you carry along with you. And when I was talking about the shuttle, as soon as they step in the shuttle, they open their mobile phone, and they are deep into the sea of knowledge, deep into the sea of another world. And I see them, they are so absorbed. So this is very lucky situation for you. And you, the young people, you are so tech savvy. You know exactly how to exploit your technology, your technological availability that you have. And I feel I was lucky when I was as young as you are. But this is definitely, look at this slide. I know that you have the virtual world in your hand, but also you need a platform like this where as you move on in your career planning, as you're moving on or on your right for your better career, you have this platform, you have this academy where you learn in the real world. This platform is important. You have people that you can talk to. There are speakers, there are educators, there are trainers, and also there are team members. Also, there will be available courses that you can select and you can go direct. So this is an excellent platform. And as you see the blank lines at the bottom, you can make a long list. And I know that Sheikh's platform is going forward, and there will be many more items added to this table when subsequently we'll be making this presentation. So you are lucky to have this platform, and I would encourage all of you to join this team and be part of it for your own convenience and for your own interest. I know that we are talking about the career, and if you look at the slide, I said there's a car, there's a E, and there's a E and a E R. When I was looking at career and I tried to break it down, I said, how do I feel? What is my life experience? So my life experience is that you are sitting in a car and you have an excitement and you need to put in energy
Oh my God, it's
and
always
then
down.
drive. So that makes your career. So you have a car, you have a excitement, you have energy, and you write. You just write. So that is the career. That is the way I look at. And I have like 6 Ds that I have designed as I was thinking of career. How you do that. So you describe your aspirations. You diagnose what you have, what are the positive things you have, and then plan accordingly, plan your opportunity, and then you design. You have a blueprint, search the availability, and then you develop yourself to fit in, have your skills and fit in the position that you are dreaming of, and then you demonstrate. So that's the challenge, that you show off, you display and do that. And then you drive at a higher speed. So these 6 things I'll be talking very briefly. I know that time is an issue here, but I'll try to as quickly as possible. So when we look at describe, and you close your eyes and you what are your dreams? You talk to yourself. What is my dream? Where I want to be from 2 years from now, 5 years from now, 10 years from now, 25 years from now. You ask me, Halida, where are you 35 years from whenever you are at that time? So you have to create a dream and you write it down on a piece of paper, not in the computer. So the paper will be in front of you, reminding you where you want to be. What are your dreams? How are you going to fulfill that? The next is diagnose. I'm a medical person, so I'm using medical word intentionally. I could have used something else. So diagnose is look at your strengths. What are your positive symptoms? What are your negative things? So what is your background? What is your education? How is your family? Who is going to support you? Where are you sitting today? Where can you go tomorrow? So that diagnosis of your strengths and positive things and negative things will help you analyze which direction you will take. What are your resources currently? So analyze your own current resources. And then you plan your career. So I say design. When you have developed, seen the construction of a big building, what do? They have a beautiful blueprint that tells you everything. And then you need to find your ingredients, the people, the resources, the money, the bricks, the cement, and all these things. So that's what you have to design. You have to look at what is needed to get the job that you want. What kind of skills are needed? What kind of whether those skills are available, and what will be needed to acquire those. So you see through those items, analyze them, and then again put it in your plan blueprint. And then then the next phase will be, yes, you are now, you know where you want to go or which direction you want to go. You want to study further or you want to get a job. Whatever it is, you have to find out what are the required skills, what is bare minimum skill to enter into a job, and you start there, and then you add on your capacities, add on your skills, add on your knowledge and certificates, and then you move on to the next phase of further applied skills, further advanced skills, and add to your relevant qualifications. If you look at the next, what is the next phase now? The next phase will be you start. You have prepared yourself, you start. I think my suggestion from my lifetime experience and from others that I have seen and helped develop is you start with this, with an easy platform so that you can enter. Most barriers is to enter into a workplace. So entering is very critical. So you enter where you find easy access, and then you explore what are the opportunities sitting there. Once you are in a job, it's easy for you to explore the branches, the more scopes, the specialization, and then you gradually plan your movement into that direction, into that by lane, into that advanced stage. Once you are there, once you are sitting in your job, in your position, it is challenge to you is to demonstrate, is to share and demonstrate what are your contribution to the institution, to the department, or to the project, or wherever is your workplace, what input you are making and what contribution you are making. And then you showcase your talent. In addition to that, you have to, you are a good orator, so you find an opportunity to talk. 5 minutes talk, good enough. You are an artist, you say, okay, I'm going to do some artwork to, in the next seminar, and that's going to be. So you share your skill, you display your skills that you have acquired, your inherent skills, but you have to have an extra effort to display that, to showcase that. And if you have a leadership skill, you go ahead and be the leader. You stand in front of them, you have a team, you have the team follow, or you follow the team. So that kind of demonstration at your workplace is very important to make your presence visible and your value added to that institution. And the next phase will be, now you are in a driver's seat. You have a seat belt tight already, and you have been driving at a 5 mile speed, but I want you to drive at a higher speed, 15 miles, 25 miles, 50 miles, 60 miles. And that is going to be your additional effort to be the achiever, to escalate your current position and move up to the next one where it gives you satisfaction, where you are happy, and that will continue. It's a never-ending process, as some of our friends mentioned. So escalation is never ending process, and you continue to do that. So this is the way I have seen my life, and I will share with you. And I would like to see, this is in a very general way, but that these are the steps that I see is very important as you plan your career. Since I'm a person of public health, I would like to give an example, and just some real life example. And as you know that, I will talk about public health because that's my area, but I have seen that the health sciences have grown over the early 21st century, and the public health and health science are kind of siblings. They complement each other. They support each other. And I would like to talk both health science and public health, because public health has, the people, they need some health background, like they have to be doctors or nurses or paramedics, something. But health science incorporates people with a broader science, and they can come in the health. So that's why I'm talking about health science as well, so that a larger group can be incorporated into the career. The civic mind individuals can pursue their public health career and come to the health side. Health, if you look at this slide, you can see that health science has a a new academic focus, and it incorporates epidemiology, sociology, psychology, health policy, business, costing, and you can name anything, environment, and that fits into the health sciences. It is a broad interdisciplinary field. It incorporates natural sciences, it incorporates behavioral science, technological science. So it has a very wide range of discipline that it can incorporate. And the more I see, the more I get surprised at how much can be included into the health. And when I was doing my MPH, we were not only the doctors and nurses and others, but we have seen a legal professional, we have seen other professionals who are not directly from the health sciences came and did MPH along with that. There are other also masters in health sciences, and they can also do all these academic certification and post-graduation courses. If I give some examples of the health sciences experts, like the mental health counseling, the physician's assistants. I mean, if you go to a hospital, you will see that a physician needs so many other departments to help that person and the patient. I mean, those are all the careers that goes to the health sciences people, healthcare support, technologies, and you name any of all those things. It definitely incorporates, the healthcare of a big community, large community, and a large community of experts can come and join, and it gives a wider choice to the career of a health science people. Let me come to the public health a little bit very quickly. When we talk of public health, it's health, but when we think of a clinician, a clinician, my mother was a gynecologist and obstetrician, and I've seen her treating patients. This is such a graceful job, such a life-saving job she has done. But when you think of public health, it's the whole community, it's the whole neighborhood, it's the whole country, it's the whole region that it covers. And I think the COVID-19 is the best example of the need for public health, need for science in public health. And so what does it do? It protects and improves the health of families and communities by protecting the promotion of the health lifestyles, searching for causes of diseases and plan for the prevention of these diseases, prevention of the injury, reduce mortality, reduce morbidity, and control the situation, change behavior of people so that their lifestyle changes and their lives are saved. And so it's for the protection of the health of the entire population. If someone wants to be more closer to a disease, with a medical background or others, definitely there are many preventive aspects of diseases like diabetes, like heart, disability, drug abuse, obesity, and there I can add 50 more list into that one. So it's an endless opportunity for a career. So what public health career will give you? What kind of satisfaction you can get? I mean, I'm sharing this thing just to help thinking. Today when we talk about all these protests and the public health response to this protest, you can see that there is a major public health input in saving lives of people, in saving spread of the disease. So, and we have a lot of talk about disparities. So public health understanding will help you limit health disparity, promote healthcare equity. It goes to men and women and children and everything and all types of color and everything, and promote healthcare accessibility. So the access of everybody is promoted. You monitor the health, and that's how you know who is getting services, who is not getting, and the quality of health. Foster safe and healthful environment. That's so important. Implement prevention strategies and provide leadership. We have to really think very big, think the large population and their behavior, their health needs, and the planning. So what we see here that basically public health is for the protection of the population from disease and disability, from mortality and morbidity. I'm repeating myself. But when you see how it is done, you know, the doctors go and treat patients, okay? They give injection, they give this, and they admit to the hospital, they give, put them to ICU, put them to ventilator. But what public health does, it increases the educational program. It teaches how to maintain distance. It teaches you that you have to wear mask, otherwise you are going to die. How you relate the mask to the death. That's the richness of public health. Recommending policies, recommending interventions, and that this is the most life-saving intervention. This has to be implemented. Administering services, administering cares and projects, and conducting research to know more about these things. So these are all within the public health area. So we see opportunity for many scientists, for all scientists, environmental scientists, behavioralists, managers, leaders, coordinators. You can coordinate large program. You can be chief of party like me and coordinating, you know, like 50 NGOs and 25 million population and all these things, and even bigger than that. So there are jobs, and as you see in US or any other country, these public health job locations are within the government, in the local areas, in the state, federal, multinational organization. You talk about UNICEF, all UN organizations, and there are many other non-profit organizations, international NGOs who are looking for public health experts, private non-profit, for-profit. There are many pharmaceutical agencies, you know, like, and the labs and others, they also need public health people. So when we look at the concentration of public health, what are the subjects that belong to public health? So like when we were learning epidemiology, biostatistics, environmental health, ecology, you know, health education, behavior, health, infectious disease, public policy, you have to know, global health, nutrition, maternal child health, reproductive health, adolescent health, women's health, gender issues, gender perspectives, you know, other disparities. So these are all under public health, and that gives opportunity to an expert who wants to be in the public health domain for their career, and it is available. A country, the developed a country, the more public health opportunities are higher in those developed countries. So definitely public health opportunities are higher in a developed country more than a developing country. Developing country, you have to sit and create environment, but in a developed country, environment is there. You just have to enter with your skills and capacity. Now this is a very crowded page, and you can see the title, that Me and My Journey. I don't know how much time you have, Jillur? Okay.
We are
I
over
know.
by a few minutes
Okay, so
already,
I'm
actually,
kind of
but
close to
let's.
my last two slides, so I think so this is my Halida in one page. Okay, you see my picture, and if you look at those two piggy banks, pink and yellow on the left side of my picture, and those are some of the innovations that I did in the Smiling Sun project in Bangladesh. And maybe there will be another opportunity that Jillur will give me to talk about more the innovation and the community empowerment that I did in that project. But today basically is my life. So I just take a few minutes. I started with a government project, and it was family planning board. People, I was MBBS from a very number one medical college, and I joined family planning. So people were looking at me. I said, "You must be a backbencher. Why did you go to family planning?" I mean, people don't even talk about family planning. But I went to family planning, and within 6 months, government, Ministry of Health sent me to US. And I think I was destined to that, sent me to US. And there were some courses at Hopkins, and also some project visit and look at the programs that Hopkins was implementing in public health, and also in family planning and abortion and all these things. So I saw the world. I saw the world, the breadth and length and spread of public health. And sitting there, I said, okay, I'm going to do public health. I'm going to come to public health. So that was my opportunity. And then I went back, and I left the government. I joined a project where I learned a lot. After that, I came to do my MPH and DRPH at Hopkins. Pathfinder gave me a scholarship. Hopkins gave me for my doctoral program. And then I went to CDC as a Rockefeller Fellow and became EIS. At that time, only US citizens were allowed to go to the CDC to be the US, but there was a special program, and I was fortunate enough to avail that. Now, the reason I'm saying that, I was placed in a division of reproductive health, and that's when I came to know the word reproductive health, and came to know that disciplines, that subjects, and the services and the issues that are incorporated into the word reproductive health. So after I went back to Bangladesh, I joined Ford Foundation because I had to go back, and I work in Ford Foundation, but I did not work with a donor agency because I wanted a Bangladeshi institution where I will lead, I will become the leader, and I will be known as what Bangladeshi woman can do, and how can she be leader. So that was my challenge to myself. That was my dream. So I went in a very low salary to a Bangladesh BFRP, Bangladesh Fertility Research Program. So that was funded by FHI 360 now. It was at that time IFRP, International Fertility Research Program. And I said, okay, I'm going to enter, be the director of that one. And then I will see what I can do. So what I did, I had a committee chaired by secretary, and I said, secretary, sir, I want to change this to an institute, to a reproductive health institute. You have to help me. And he did help me. So within 2 years, I changed that program into a Bangladesh Institute of Reproductive Health and Technology. So it was some money I brought, and then it became, they call it BARBERT, and then so that became an Institute of Reproductive Health and Technology, and I led that for additional 14 years. And that's where I developed people. I brought in doctors to public health. I brought in doctors to reproductive health. I taught them research methodology. I did a lot of research in the field of reproductive health, maternal mortality, maternal morbidity, adolescent health, family planning, and all is a big spectrum of work that I could do. All those things that I have learned while giving services, I wanted to do research because that was a research institution. The reason I made it a quasi-government, because then I can sit next to the government senior people and do my advocacy. So my two objectives, one was to develop capacity within the organization. Uh, Number two is to identify the problems of women and reproductive health related problems and advocate to the government so that the quality of life of women increases. So those were the two major, and be the leader. I mean, that was my selfish motive. I wanted to be known. I want people to recognize my credibility. I worked very hard. I brought in money. Government did not give me any money. I brought in donor funds and run the institution. Now, if you look at the middle list, so World Bank Washington wanted me to a long-term consultant, so I came to World Bank. WHO put me to its innumerable number of committees for 16 years: contraceptive safety, efficacy, medical eligibility criteria, maternal health, task shifting, you name anything. So over a period of nearly 20 years, I would say, I was involved with WHO in various committees, sometimes as a chair, sometimes as a member, sometimes as a resource person. So my reproductive health entry had helped me to do that. And research is another area that also helped me to go to Geneva. I would like go on an average twice a year to Geneva for over 16 years. And then then I was also in some other committees like IPPF London, had EMAP, International Medical Advisory Panel, and also I was chair and board member of two large organizations, US based. One is FHI 360, it became 360 later, but also PAP Seattle, and I was 9 years on their board, 5 years on their chair. And these are all cumulative. It's like snowballing, one will lead to the other, and people recognize that what I'm doing and all these things. um, because I was doing research, I was and giving lectures, I was also in the peer review journal reviewer international. I cannot now count that how many international conference I attended, I made presentation, I participated. Publications, definitely I had research reports that we have done, and contribution in the chapter. Um, I did get award from international award, and first one was Johns Hopkins Alumni Achievement, but that was much later than I graduated. They wanted me to come to Hopkins and take that award. Then the German World Bank, it's the Gießen, Justus Liebig University, they had a developing country award, and I got that in 1995. They took me to Gießen, to Germany, and then I took that award, came back. There was ASCON, was Asia Regional Conference on Nutrition and Diarrheal Disease. I got a Lifetime Achievement Award. And then I think that in 2006, I got UN Population Award. So they invited me to come to UN in New York and take that award. And this is usually they give 2 awards a year, one to an institution, one to an individual. And I was fortunate enough to get an individual award, become the individual laureate of that UN Population Award. So the reason I'm saying these things, that one leads to the other, your hard work leads to the other, your visibility leads to the next phase. And definitely if you are working hard, if you are doing things, you get recognized. Somebody, whoever nominated, I never knew who nominated me. It's always unknown to me. Later I came to know that who nominated me. But it was always somebody else who nominated, and I got the award. So this is very quickly my journey. I can talk about this thing forever, but for today this is good enough. Thank you very much. One more thing that I cannot stop but saying, because I was doing reproductive health, you came to know about Cairo conference. It was in 1994 September, that Cairo conference. But there were two preparatory committee meetings in United Nations, ICPD PrepCom 2 and PrepCom 3. And I was in the PrepCom 3, I was made vice chair of the reproductive health, which is chapter 7 of Program of Action. And Program of Action had 13 chapters. Out of that, chapter 7 was reproductive health. And I was sitting on the UN next to the chair, Ambassador Bigman, and Halida wearing sari was sitting next to him. What a great scene to see. And I just thought that it has made my life, when I was sitting there and talking about reproductive health, getting the reproductive health weighted from 190 countries who are present there. The government people, they were very touchy about abortion. They're very touchy about menstrual regulation and all these things. And we had to get everybody agree to every word and every sentence that was written there. So that was a great learning for me. I think I should end here, but now next slide is my last slide actually. So what we have learned, this is a piece of advice for whoever are listening, my younger friends. When we talk about showcasing your demonstration, you make yourself visible, you need to volunteer. And in my life, whenever I have volunteered, I have gotten so much benefit out of volunteering to do something that is, okay, you are already a doctor. Why are you going to write minutes of a meeting? But you do not know how much extra mileage you get to just be the rapporteur of a meeting. That gives you to take notes, that gives you an opportunity to make a presentation, and that gives you opportunity to share your skill, your oration skill, your presentation skill, and everything. So you have to find an opportunity to showcase yourself. You have to mentor others. You have to maintain your connection with your mentor of the whole life. The other day, we had Eid. So one of my mentors, I said, Roger, Eid Mubarak from me. And in return, he said, Halida, you just sent me the wishes. So appropriate time. Someone is going to call you and interview you because that person is doing thesis on my life. And I have listed you as one of my important person in my life, and she will be interviewing you. So connection brings connection, and it benefits you always. You just do that.
Dr. Halida?
Yes, I'm
Yes.
finished.
No, I mean, we're enjoying, and this is actually will be disservice to go through it or zoom through it. What I mean to say is that it is plethora of information and inspirational.
Right.
I just talked with you and everything. I remember talking to you.
Yeah, I will just finish. This is my last slide, and I know that
Okay, okay. No, and I have a question also that came
oh,
also
okay,
after that. So,
okay.
but go ahead, go ahead. But that's a little bit different topic. The question came.
Okay, okay. So
So
I
you
will
go
just
ahead.
finish that. This is more a showcase in how you elevate
Yes, yes.
yourself, how you escalate yourself, how this is after you have a place, how you move on to the next phase of your career. So these are some of the things that I have listed, and someone can always review it and see that. I think I have said I don't have to explain all of those separately, but is connection, is interconnection, is recognizing, is appreciating. These are the values of life. These will help you move forward in your career, in your accomplishment, and in your visibility and other things. I think these are continuous. I mean, today I'm doing it. Everybody has to keep on doing it. So this is my basically the last slide of the presentation. And thank you very much. Thank you. I know that it was a long session altogether, but thank you, Sheikh Zillur, for giving me this great opportunity. I thoroughly enjoyed the session. Yeah,
Oh,
I'm done.
thank you, thank you. No, thank you, and thanks to all the panelists. I just want to bring everybody who's here, and we could not bring everybody who we were with earlier, unfortunately, because the technical ability and everything that we have. However, there is one question that came in, which is slightly different, but I'm gonna say it anyway. So, with a small discussion or a 1 minute of it, take on it, we can kind of end it because we're way over time. Usually,
Sure.
we'll try to keep our time within the limit. We have a 75 minutes sessions. That what we are banking on. Actually, we're thinking of doing on a weekly basis, not more than that, start to finish.
Okay.
So anyway, this person from Bangladesh, I believe, Lubna Yasmin,
Yeah.
he said why it is so time consuming to bring some changes of the poor class people and villagers also to follow the law of the land. What should be the basic strategy for awareness to address these poor people, which is minimum requirement? So and he gives an
Okay.
example also. So I don't know if you want to say anything about it, or any of the panelists want to just comment anything on it.
So any of the panelists, I mean, I would like to request any of the panelists may be interested to talk about that. If not, then I will. Okay.
Did you guys hear me, or anybody has any? Did you follow the question, or should I try to
Yeah,
repeat that?
can you repeat that, please?
Yeah, it says why it is so time consuming to bring some changes of the poor class people and villagers, also to follow the law of the land. What should be the basic strategy for awareness to address these poor people, which is minimum requirement? And the example she says is that COVID-19 situation, it is very good practice to wear masks, but poor class people are not maintaining the norms in Bangladesh or other areas where spreading the virus, and as they are non-symptomatic, they are roaming around. So I don't know. This is
So
a
anybody,
little bit different, but kind of related
anybody,
to public
I,
health though. So yeah, go ahead.
I can talk on that, but if anybody interested, I would like to give that opportunity. Um, okay, let me respond to that. I know that Lubna asked a very good question. So it's not only the poor people, it's even the educated people. The behavior change is so difficult. Let it be a poor people or educated people. If you look at the US scenario, here more people are educated, but even then you see a large proportion of people are not wearing masks, not maintaining this social distancing, and not doing many things. So I think it's the way how we communicate, how you talk about science and relate to them, relate to their health, relate to their disease condition. So it's the power of communication to that person based on that person's background. It's not only poor. Sometimes poor people listen you better than an educated person. So how you convince that person, whether something else is contaminating, we don't know. But always public health has a challenge of communicating, changing the behavior, so that changing the lifestyle. How much time still we are struggling to stop smoking. And we know for centuries that smoking brings lung cancer. Still, people are smoking. So it is behavior change, changing lifestyle is always very difficult, but we have to keep on doing it. And we have to design how to communicate. We have to follow up whether things are happening, change direction, change courses, change language, use different media. I mean, I have a friend who just used photography to communicate public health. So, there are many ways that we can communicate public health messages.
It's
Thank
wonderful,
you for
wonderful,
asking me
wonderful to know. Yeah. Okay. So based on that, and in the essence of time, if we can take just a minute on that question, or what Dr. Halida's talk, or to end it, if we can have just 30 seconds, 60 seconds things from each of you, I think that would be great. Raj, if you don't mind, if we
very
can start from you, anything on take, anything to say, or for the young professions, or any of your thoughts.
Well, absolutely, absolutely. Thank you, Sheikh. I know we went over time. I know we had some technical difficulties, or I would not say the word difficulties. Challenges is the right word. Yeah, not difficulties. Yeah, challenges.
challenges, yes.
And Dr. Halida, I mean, you just gave us golden nuggets today. For Young Titans platform, it is such an important thing to take back for young professionals to see that if you are on your mission, if you are passionate, if you know what you want to do and you keep on going on your goal, things open up. You will figure out the way like you did. And you are sitting with the people at you, and I mean, come on, that's so wonderful coming from uh, where you were to where you are now is an example which people can not only follow but they can emulate. And that is where I think this gave such wonderful information, which is going to be really uplifting. Anybody who has not heard the whole thing, I would say go back, listen to it. Is that important? And
Thank
this is what we are going to bring you every single week from now on.
you.
And so I'm
Thank you.
privileged to be a part of it. And thank you again, Dr. Alida.
Thank you,
Thank
Raj.
you,
Thank
Raj.
you for
Thank
this
you.
one.
Kamrul, anything on that question, or Dr. Halida's talk, or anything on your thoughts?
So, first of all, I think this is what actually we need to do more and more. I think the world is missing this part. Uh, those who have achieved a lot in their life, if we can bring them to the service to the community for building our young professionals and students, I think that's the one of the very few way to build the world and add value to them. Because if we are not coming forward, who else will? If we are not coming forward to help them to build ethical business, who else will? So that's what actually our mission, and it's together, it's everybody's mission now. So it's a privilege, and it's my life mission as well. So I'm thrilled to be part of this Titan initiative. And of course, Dr. Halida, ma'am, it's wonderful knowing you and getting connected with you. And we know we need more of you, and also with you some people like you who also can come forward and connect us, help us. That's the only appeal that I can place to you through Sheikh Bhai and everybody, because we need it badly, very badly. And it's been late. I think the world needs it more than anything else today.
Thank you.
Thank
Thank
you,
you.
That's what
Kamran
I
sir.
want to
Thank you
say.
very
All
much.
right.
Thank you.
Jan, Arti, you guys, your value addition. I know I've been waiting for some nuggets from you, of course, because of the time and all this need. It just it was not favorable in many things, but still, whatever time we get from you guys and all of you guys, I'm thankful as one more time. But anything you want to add, say, or to this platform, or to Dr. Halida, or your thoughts, please.
Well, I think one of the brilliant parts, you would have seen that we were giggling a bit during the presentation. That is because it was striking a few chords. That is exactly what this platform's all about. It's about challenging mindsets. It's about bringing different people with different genres, experiences, exactly what Kamrul talked about and what Raj spoke about, is bringing people of experience and influence into one platform, the Young Titans platform, which means that everybody has got access to knowing where they can go forward in life by listening to all of these various experiences and where people have come from and where they're heading. What I loved about the first slide was talking about your vision. You know, a lot of people are in a process right now of choosing or changing their career path or wondering where to next. What I love is that having a vision for where you're going and then creating the platform and the core team to surround you to give you the ability to succeed is the powerful part. And I know that the collaborative partners on this platform are specifically chosen by yourselves to add value. And I love that. It's about serving everybody here, all of the young people, wherever they're at, knowing that they can have direct connection, Q&As, and to have dialogue. So it's not one of these platforms where you just got to sit and listen. It's the whole interactive side, which is the brilliant part. So I welcome everybody to join us on these talks, and we look forward to learning from all of these professionals and influencers as well, because we learn continuously. I think that learning is a lifelong journey, and we're excited about this too.
Yes, and for me as well, it's at times like this we find out who our real leaders are and what our real leaders need, because leaders are not built in this time, they reveal themselves. But we also know that there's a lot of anxiety, a lot of stress, a lot of depression, a lot of things going on now, and especially in the younger people. I mean, we are coming from a generation that we still believed that we could have a job for 45 years. And the unfortunate thing is, in one way, people still do this, and more than 75% of people are unhappy about what they're doing. Now, the confusion that must be raging now because of the change of technology, the change and these uncharted changes that we're having just now, the character building challenges I like to talk about, it must be something that in our youth is a frightening prospect. And to have a platform like this, we are so grateful to be part of this platform, and also with Kamrul's platform, because it is so important that we actually come together, as whether we call ourselves more experienced or we are now further developed, whatever it is, but we all have things that we need to, we can't only bring it to the table, we must bring it to the table, because we have a duty to the next generation to help them to succeed in life, to at least give them that direction, the focus, because even having a piece of paper now when you come out of a university, so many people don't even know what to do with that piece of paper anymore, because we need to help them to find their passion, everybody's got a journey, so to help them find their why, their purpose, their passion, and find them to get to their destiny, whatever that looks like. In this platform, I think we can together, we can all bring things to the table that will really help our young leaders, our young titans of tomorrow, the young titans who are going to be the leaders of tomorrow, to give them the skills, the tools, the tips, and the information to make sure that they're going to be much better prepared for life to come. And I think for us it's a duty, but it's also a privilege and an honor to be part of this. And I thank you, Sheikh, and everybody else for inviting us. And we look forward to working with all these young titans. And I think if any of them are listening or watching this now, like and share this, bring your friends, because there might be one thing in the next session you hear, there might be one thing that you've missed this now, but there might be one thing in the next session that you will hear that will change your life. We will do our best. All you need to do is come and turn up and engage with us.
Wonderful.
Thank you.
Lastly, Ron, your opinion, comments, or anything you want to add, please.
Dr. Halida and Sheikh, thank you very much for this opportunity to participate with you. I'll just say very briefly and succinctly, critical thinking is one thing that I like to engage in. There is, for every challenge we have, there are multiple solutions that can be brought out. It's a matter of selecting the best option, but if we think through everything and we look at all the facts and factors, we're able to come up with a viable solution that is very specifically tailored to anyone. So as we are able to help those who participate in this with any challenges they have, I believe that is one of the things that can help a person to devise a very customized solution that is tailored to your strengths, your passion, and everything that has been discussed to this point. So thanks to each one of you for this opportunity to participate with you.
Well, thank you, Ron. So that was very nice. But again, because of time and everything, we'll end it right here. Thank you, Dr. Halida. Thank you, all of you and everybody who were with us earlier. And then there's many who wanted to be part of it, or I could not bring it online live. But and thanks, special thanks to Kamrul for his team and the IT support, and then the behind the scene people, few volunteers. So I don't take anything lightly, but at the same time, I think none of us should take it lightly, because it is for a different cause, a noble cause, and I think people who will get the benefit, they will be thanking each and every one of us, and their lives can be changed. For one of you, you said something profound, and I know that had happened for me, so it can be true for everybody. But with that, I would say, unless you have any question or any last thing or anything like that, would like to end. We'll do it again next Saturday, and would like to get more of you, young professions, or more of reference for speakers who you like to hear, such as Dr. Halida, and I'm sure and I hope she'll be coming for our future sessions also, and would like to have this kind of panels and other sessions as well. So we'll put together a few courses, this, that, and keep adding that in our portal as well. And what else can we do? So thanks to Jan, Arti, Ron, Kamrul, Raj, and Dr. Halida here, and lots of others who we just had a little private discussion and a live session earlier, and who already wanted to add value. So thanks to all of them, and who are watching it on live session and later in the course. So Obi will end it. Thank you again for the people, and have a safe time, a safe weekend, and let's get it going. And give me some suggestions. Send some comments over.
Thank you, Jilu, for having me on. Thank you very much. Thank you. Appreciate it. Yeah.
Take care, guys.
Thank you.
Thanks to everybody. See you again.